Hi, my name is Savannah, and today I'm doing my validation video for eyes, ears, nose, mouth, throat, thorax, and lungs. So in the hospital setting, I would first knock and wait for permission to enter the room, and then upon entering, I would immediately film in and introduce myself. Hi, I'm Savannah. I'm a student nurse at Advent Health University. I'm here to do an assessment today. Is that okay with you?
Yep.
Could I please check your wristband, please, and verify your name and date of birth?
Albernie Chavez, April 1st, 1992.
Beautiful, thank you. So I'm going to start with her eyes. I see that you wear eyeglasses. Do you also wear any contacts?
Yes, I do.
Awesome. Could you please remove them for this assessment, please?
Sure.
Thank you. So for her external structures, her eyebrows are symmetrical and the hair is evenly dispersed on both eyebrows. Her eyelids, the skin is intact. No signs of lesions or discoloration. No signs of ptosis. Her eyelashes are evenly distributed. No sparseness. Okay. I'm going to check your conjunctiva, so please look up when I pull down. Her conjunctiva are nice and pink and moist, no signs of infection. Her pupil is nice and round and without dilation. About a 6mm gauge. Her iris are brown and round and equal bilaterally. Okay, so your sclera is nice and white. I'm just going to shine a little light for your cornea. All right, nice and transparent. No signs of cloudiness. Okay, would you please look at the light up here for me? All right, corneal light reflex is equal bilaterally. I'm going to shine a light in one eye, so bear with me, please.
Okay.
Consensual response is present. With light stimulation, dilation goes to 4mm. Okay, so I'm going to test your field of vision. Could you please look at the tip of my pen light and follow it with your eyes and not move your head?
Okay.
Okay. All right, and watch it come in, please. Awesome. All fields of vision move smoothly with transition. Eye accommodation is within normal ranges. So I'm going to move on to her ears. I'm going to inspect them externally. The skin is intact, no discoloration or lesions. Have you had any changes in your hearing in the past 6 months?
No.
Okay, so I'm going to palpate her ear for any abnormalities or lumps. Let me know if you have any pain or tenderness as I'm touching you, okay?
Okay.
Everything feels normal. The client has 2 lobar ear piercings bilaterally. All right, everything checks out nicely. I'm just going to shine a light in your ear. Okay. Ear canals are nice and clear. No signs of discharge or infection. Okay, so I'm going to perform what's called a whisper test. If you could please plug one of your ears like so.
Okay.
And I'm going to whisper into the other ear and please repeat what you hear.
Okay. One red dog.
Okay, and the other side, please.
2 blue fish.
Beautiful, awesome. So moving on, I'm going to inspect her mouth. Could you please smile for me? Okay. The teeth are nice and white. No signs of dental caries. The gums are nice, pink, and moist. Have you seen your dentist in the last 6 months?
Yes, I have.
Awesome. Could you open your mouth, please? Her buccal mucosa is nice and pink and moist. Her tongue is midline and symmetrical. Could you please lift it up for me and to each side? All right. Tongue muscle movement is adequate. Do you have your tonsils?
I do. Yes.
All right. Could you please say ah for me?
Ah.
All right. Cranial nerves 9 and 10 are intact, and her tonsils are viewable, and no inflammation or redness has been noted. Okay. So moving on, I'm going to inspect your chest and your lungs. Could you please remove your shirt for me?
Yeah.
Okay, do you have any conditions such as asthma, bronchitis, emphysema?
No.
Okay, so inspecting her thorax, her skin is nice and even, no lesions or discoloration, no visible growths, skin is nice and warm, no excessive moisture. Okay, I'm going to begin with palpation. So I'm going to take 2 fingers and place them in spots and move them in small circular motions, checking for any lumps or growths or tenderness. Is it okay if I touch your chest?
Yes.
Okay. So I'm going to begin in the supraclavicular pocket. Small motions with light pressure. I'm avoiding bony structures like her sternum, focusing on her tissues. All right, I'm just going to go in between your breasts real quick. And could you please lift them up for me?
Yep.
So, thank you. Do you have any tenderness or pain?
No.
Okay. Awesome. Could you please spin around for me so I can do your back?
Yes.
All right. So again, I'm going to begin posteriorly above the clavicle. And on this posterior side, I am going to avoid the scapula and the spinous processes and really focus on these tissues posteriorly as well. Any pain or tenderness back here?
No.
Okay. So one more on each side. All right. Everything feels good, no abnormalities. You can turn back around for me, please. All right. So now I'm going to begin my percussion. I'm going to take 2 fingers and tap, checking for resonance. I don't want to hear any dullness, because that could indicate some issues with her lungs. So again, I'm going to begin in this supraclavicular pocket. As I move my way down, I'm going to stay in those intercostal spaces. Could you please lift your breast for me?
Yeah.
I'm just going to get right up in here. One more on each side. Beautiful, thank you. Could you please turn around for me? All right, same with the posterior side. Starting above the clavicle line. Avoiding the scapula and these intercostal spaces. One more on each side. All right, could you turn back around for me, please? Okay, so I'm going to listen to your lungs. Whenever you feel the stethoscope, please take a full breath in and a full breath out.
Okay.
If you ever feel any shortness of breath, just let me know. We can take a break.
Okay.
So before beginning my auscultation, I would clean off my stethoscope and warm it so it's not cold against the client's skin. Okay. I will begin by listening to the apex of the lungs within the supraclavicular pocket. Could you lift your breast for me? Thank you. Thank you. Could you please turn around? All right. While I'm auscultating, I'm listening for any wheezes or crackles that could indicate any issues with her lungs. Is your breathing doing okay up there?
Yes.
Okay. Beautiful. Her lungs sounded nice and clear in all the lobes, anteriorly, posteriorly, and laterally. Now I'm just going to check her lung expansion. All right, so I'm going to place my thumbs framing the T9 and wrap my fingers around her ribcage. Could you please do a full breath in and out, please? All right, the expansion is equal bilaterally. Next, I'm going to do my tactile fremitus. Whenever I place my hands on you, please say the word 99 nice and clear for me.
Okay. 99. 99. 99. 99.
All right, could you please turn around? All right, and the same thing.
99. 99. 99. 99.
All right. Adequate vibrations were felt both posteriorly and anteriorly. I'm just going to check your skin turgor, see if you're hydrated. You're going to feel a little pinch. All right, we have nice elastic recoil, so our turgor is great. I believe this concludes our assessment for today. Can I get you anything else while I'm in here?
No, thank you.
Well, here's your call out if you need anything, and I'll come back to check on you soon.
Okay, thanks.
Okay, and that concludes my validation for today.